How does enzyme inhibition influence the therapeutic outcome or risk in veterinary toxicology? Enzyme inhibition can either prevent the formation of toxic metabolites or delay the elimination of parent toxicants, increasing risk. For instance, cimetidine is used to treat acetaminophen toxicity in dogs and cats by inhibiting CYP2E1, reducing the formation of hepatotoxic NAPQI. However, if the parent compound is toxic itself, inhibition can worsen toxicity. For example, when ketoconazole inhibits CYP3A4, it slows monensin metabolism, leading to fatal cardiotoxicity in pigs and poultry. What is the clinical implication of CYP3A inhibition in animals receiving ivermectin? CYP3A inhibition, by macrolides like erythromycin, shyamulin, or ketoconazole, leads to elevated ivermectin levels in plasma. Normally, ivermectin is kept out of the brain by P-glycoproteins, PGP, and metabolized by CYP3A. Inhibited PGP or CYP3A increases CNS penetration, leading to neurological toxicity, especially in MDR1 mutant breeds like collies, for example, signs: ataxia, tremors, coma. What happens when animals with MDR1 mutations are given PGP substrates? MDR1 mutation results in non-functional P-glycoproteins. These dogs, for example, collies, Shetland sheepdogs, long-haired whippets, cannot effectively exclude drugs like loperamide, vincristine, ivermectin, or acepromazine from the brain. Thus, even standard therapeutic doses can cause severe neurotoxicity, characterized by sedation, mydriasis, and collapse. Genetic screening is critical before prescribing such drugs to herding breeds. How do macrolides and shyamulin interfere with the biotransformation of other drugs? These antibiotics form metabolic intermediate complexes with CYP3A, leading to persistent inhibition. This prevents metabolism of co-administered drugs like monensin or steroids, increasing their plasma levels and toxic effects. For example, shyamulin plus monensin causes muscle degeneration and heart failure in pigs. This risk extends across species and must be accounted for in mixed medication regimens. How does pre-exposure to phenobarbital influence acetaminophen toxicity? Phenobarbital induces CYP enzymes, especially CYP2E1, which increases NAPQI formation from acetaminophen. If GSH stores are sufficient, this reactive metabolite is detoxified. But in depleted or malnourished animals, for example, with low sulfur amino acids, NAPQI accumulates, leading to hepatic necrosis. Hence, phenobarbital-treated animals are more susceptible if antioxidant defenses are inadequate. How do co-administered drugs influence the binding of warfarin in plasma? Drugs like sulfonamides, NSAIDs, for example, phenylbutazone, and salicylates compete for albumin binding sites, displacing warfarin. This leads to increased free warfarin levels, potentiating its anticoagulant effects. Clinical signs may include spontaneous bleeding, bruising, or respiratory distress due to pulmonary hemorrhage, especially in dogs. What is the impact of inflammation and infection on drug metabolism? Infections trigger an acute phase response, releasing cytokines like IL-6 and TNF Greek letter alpha, which suppress CYP enzymes, especially CYP3A and CYP2C, and UGTs. This slows detoxification and increases systemic exposure to drugs. In addition, infection reduces PGP expression, enhancing drug entry into sensitive tissues. Hence, dosing regimens must be adjusted during illness, especially in animals on narrow therapeutic index drugs. Why are older animals at risk despite mature detoxification pathways? Elderly animals may have normal liver enzymes but suffer from reduced renal function, due to lower glomerular filtration rate, and hepatic perfusion, slowing drug elimination. For example, aged dogs show delayed clearance of NSAIDs, increasing the risk of gastric ulcers, renal injury, or hepatic strain. Also, cumulative tissue damage from prior exposures can predispose them to enhanced drug toxicity. What are the risks of xenobiotic transfer through milk in lactating animals? Lipophilic and persistent toxins such as PCBs, dioxins, zearalenone, and trematone are excreted in milk, posing risks to suckling offspring. For example, goat kids consuming PCB-laden milk show DNA damage and hormonal disruption. Piglets suckling zearalenone-contaminated milk develop vulvovaginitis and infertility. Calves nursing from cows that ingested white snackeroo develop milk sickness, with signs like muscle degeneration and hepatic damage. How does glucuronidation capacity affect neonates' drug sensitivity? Neonates of most species, except goats, sheep, have immature UGT enzymes, reducing their ability to conjugate and eliminate toxicants. Drugs like chloramphenicol, acetaminophen, and zearalenone metabolites accumulate in neonates, causing hepatotoxicity or endocrine disruption. For instance, piglets show high sensitivity to even low zearalenone doses due to poor glucuronidation and enterohepatic recycling. Why do calves show greater sensitivity to organophosphates compared to adult cattle? Calves lack a fully functional rumen, which in adults contains microbes that detoxify organophosphates and carbamates via hydrolysis. Additionally, calves have lower levels of esterases and CYP enzymes, leading to reduced detoxification capacity. Thus, exposure to pesticides through feed or environment may result in exaggerated cholinergic symptoms in young ruminants. What makes turkeys highly susceptible to aflatoxin B1 toxicity? Turkeys lack efficient GST ISAR enzyme, which is crucial for conjugating and eliminating AFB1 epoxide, the DNA-binding metabolite of aflatoxin B1. As a result, even trace exposures lead to hepatic damage, bile duct proliferation, and immunosuppression. This species difference explains why turkeys are often sentinel species in aflatoxin-contaminated feed surveillance. How do species differences in urine pH affect toxicant excretion? Carnivores, dogs, cats, have acidic urine, pH 5.56.5, while herbivores, cattle, horses, have alkaline urine, pH 7.58.5. Acidic urine favors reabsorption of weak acids, for example, NSAIDs, acratoxin A, while alkaline urine retains weak bases, for example, strychnine, caffeine. Thus, drug excretion is species and diet-dependent, requiring tailored dosing strategies. How does poor acetylation capacity influence sulfonamide toxicity in dogs? Dogs lack NAT1 and NAT2 enzymes, blocking acetylation of sulfonamides. Instead, the drug is oxidized into hydroxylamines, which are reactive and can cause immune-mediated reactions, anemia, hepatic necrosis, and skin eruptions. This has led to breed-specific warnings for sulfonamide use in veterinary medicine. What are the implications of breed-specific TPMT polymorphisms in dogs and cats? TPMT detoxifies thiopurines, for example, azathioprine. Breeds like giant schnauzers have low TPMT activity, making them vulnerable to myelosuppression when treated. Cats also exhibit a six-fold variation in TPMT activity. Genetic polymorphisms mean that even standard doses can result in life-threatening bone marrow suppression, necessitating pre-treatment screening where feasible. Why is propofol clearance slower in greyhounds compared to beagles? Greyhounds exhibit lower CYP2B expression and have low body fat. As propofol is metabolized by CYP2B and redistributed into fat, these deficiencies cause slower clearance, prolonged sedation, and delayed recovery. This highlights the need for breed-specific anesthesia protocols, particularly in lean or scythe-hound breeds. What are some clinical signs of copper-toxicosis in sheep triggered by stress? Stress, shearing, transport, mobilizes stored hepatic copper into circulation. This causes acute hemolysis, leading to jaundice, hemoglobinuria, icterus, and anemia. It's a classic example where chronic accumulation remains silent until triggered by an external stressor, requiring dietary management and stress minimization. How do low G6-PDH levels predispose animals to oxidative injury? G6-PDH regenerates NADPH, critical for reducing oxidized glutathione, GSSG, GSH, a major antioxidant. Sheep have lower G6-PDH activity, so toxins like copper, nitrites, or S-methylcysteine sulfoxide from plants cause oxidative damage, resulting in methemoglobinemia and Heinz body anemia. Similarly, cats are vulnerable due to unstable hemoglobin and reduced antioxidant defense. Why are felids more prone to oxidative drug injuries than other species? Feline hemoglobin has 8 sulfhydryl groups per molecule and dissociates easily into dimers. Combined with limited glucuronidation, cats are prone to oxidative hemolysis from drugs like acetaminophen, benzocaine, propofol, and onion ingestion, resulting in Heinz bodies, cyanosis, and anemia even at low doses. What makes acetaminophen particularly dangerous for cats? Cats have defective UGT1A6 and lack NAT2, impairing glucuronidation and acetylation. Acetaminophen is converted to NAPQI, a hepatotoxic and hemolytic metabolite. Without GSH or proper conjugation, cats suffer liver failure, methemoglobinemia, and death. Even a single extra-strength human tablet, 500 mg, can be lethal to a 4-5 kg cat.